So in this question, we are given a scenario and we have to decide the best course of action. So it is stating here that during a phone call with the patient, you encounter a language barrier as they do not speak English fluently. What is the most appropriate course of action? So choice A says to speak loudly and slowly to ensure the patient understands. Well, slowly could be helpful if they have some difficulty following English fluently, but speaking loudly is not appropriate. The patient can hear you just fine. They just don't understand the language too well, and there could be other options here that are better, so we will cross off choice A. Choice B says, use complex medical terminology to expedite the conversation. That's definitely not true. Even for patients where you are speaking a language that they're comfortable with, using complex medical terminology is never a good idea because their patient probably isn't familiar with these terms and won't understand what's being discussed. Option C says to seek assistance from an interpreter or a language translation service, and this is absolutely correct. You should always use interpretation, and depending where you are, that actually legally might be an obligation for you to use an interpretation service that the patient understands. So let's look at choice D now, just to be sure. Option D says to end the call and ask the patient to come in person for further communication. That wouldn't be appropriate. That leaves the patient frustrated. Their needs are not being met. The only time that maybe that would be a possibility is in the case there really is no language interpretation over the phone. Maybe they'd have to come in. But based on this scenario, it doesn't seem like that's the situation. D will eliminate. And option C to use the interpretation service would be the correct choice here.